Well, good morning, everybody. Right? It's afternoon, I know. Just seeing if you're awake. Everybody get their food coma and all of the great stuff that's been happening so far here at Domo Palooza. I hope you guys are enjoying the show. My name is Mike Hogan. I am a senior director at Search Discovery. We partner with Domo on a lot of different implementations and accounts. And one of the great partners that we've been able to partner with Domo is UPMC, and that's who we're going to be speaking with today. UPMC is a global nonprofit healthcare enterprise. You guys probably heard them this morning on center stage. And they turned to Domo for reporting on their digital marketing and analytics. We're going to get into a little bit more about what the journey was with Domo here in a second, and how it flourished into something that has been grasped within UPMC as just an awesome tool to make great decisions across their organization. And some of the challenges we're going to be talking about, like the fact that the data was spread across their company and all their agency partners, really proved to be, a huge challenge when it came to how do we utilize Domo to its best potential in order to bring out great business insights and also leveraging the right type of data and giving that data purpose. There was a lot of complexities that we had, and then they actually partnered with us, Search Discovery, to help them work through a lot of those complex data, implementation type of, aggregating and transformation processes that allows them to be able to get the types of views that if you were in any of their other sessions today, you could see some of the great things that were happening. So I would just like to go ahead and introduce April, who is the manager of their digital marketing area.
Hello, everyone. Can you hear me? Awesome. So Mike asked me to explain how we got started with the product. I'm the senior manager of digital analytics, and I was brought on board to UPMC to do just that, the website analytics, digital analytics. Well, it's my director, Rob Miller, he looked at Domo over a weekend with the direct connectors, and he had our Google Analytics data flowing through over a weekend, and it was in a much more usable format than anything I've ever seen. So that's how we brought Domo in. We showed a couple people internally, other departments. Everyone's mind was blown. And then from there, we got our agency partners aligned that we would now be using Domo for all of their reporting of their data. And yes, that was a shock to some of their systems, but everyone has been working with us, and I have to attribute some of the ease of that with SDI and their ability to work with other agency partners and their client to get everything aligned. It's no small task when there's a lot of egos involved at the agency and client level, so they've been great for us.
So with that, I'll take over. My name's Jake Collins. I am our Director of Marketing Intelligence. So my job is to kind of understand our patient data, how things fit in, what's going on in the market around us, and how all of that applies to marketing. And the interesting thing is, while we started with the digital marketing in April's team, we're now expanding well beyond that. So we've stood up a HIPAA-compliant environment in Domo. We are starting to load our patient data. We are one of those interesting organizations where we buy the right tool for the job, whatever the job may be, regardless of whether that causes problems for us in the future. So for those of you who are in healthcare, we didn't pick Epic or Cerner way back when there was a difference between the two. We got Cerner for the inpatient because it was way better. We got Epic for the outpatient because it was way better at the time. And we figured out an interoperability solution because that's what you do, right? Today, either one of those could give you a great solution for both environments, but way back when that was not true. So as a result, we have all of this cobbled together patient data. It's complex, it's difficult to access. You got to go to 6 different places to view it. Even our executives find it a little bit frustrating. And so now we're starting to mirror that data into Domo. The people who use it in its native environments can continue to do so. We haven't disrupted that, but we're now starting to really leverage that in a way that the operational folks are starting to notice. They're asking, how can I see that in Domo? Hey, I'm looking at the daily census data that you've got loaded into Domo, and I like it better than my view. How do we address that, right? And so what we've seen is that by putting our marketing data in there, and then by feeding in the patient data that we needed to do the marketing job well, we're actually transforming the rest of the organization because they're seeing the benefit of the platform, right? And probably not popular to say that, but we're a shop that uses Power BI, Click, Tableau, you name it, we've got it. Every department is allowed to select their own tools for the job, right? Kind of like I talked about. And here we are kind of leading the rest of the organization to Domo just by showing them the cool stuff that we're doing in it. And that kind of organic growth is really cool. But needless to say, we face some challenges, right? And so what are some of those challenges that we were looking at? Well, data literacy is a big issue, right? Your average marketing manager does not have the same data literacy that an April or I does, right? How do you get people up to the right state? How do you not scare the heck out of them when you start doing this, right? How do you make everyone feel comfortable and feel like they're getting what they need out of it? In addition, we had tons of siloed data. Our Epic teams, right, or some of our other teams, they don't want to give you that data because they're worried about what you might do with it. And genuinely worried, right? There's a lot of nuances to healthcare data. So there's concern that if you don't understand it, you might act on the wrong conclusion based on what you're seeing. And so we had to figure out, how do we bring all that siloed data together? How do we get everybody comfortable? How do we get them sharing with one another, right? Decision making. Okay, great. Now that we've unsiloed the data, how do we actually make decisions based on it? What are we looking at? What matters? All of those types of questions are the things that you kind of have to think through as you put yourself on this journey, right? Misaligned data when things don't kind of show what you expect them to, or the data isn't working the way you want it to. Security and privacy, right? We talked about those Epic and those Cerner teams. They get very worried, right? Like, you have to address things in a certain way to be HIPAA compliant. You certainly don't want data being passed to the wrong people. So you have to set up all of those privacy controls, and all of that factors into governance, right? How are we meeting to make sure that this data is used in the right way, that people are hitting the cadences, that the data is clean? All of that kind of fun stuff had to be addressed, right? And that's not the cool stuff that we're showing to other people that makes them want to do it. That's the homework you have to do to get to the cool stuff. And I can't say enough nice things about the way that SDI helped us do our own homework and get things in order so that now we can start to leverage all of that data in a way that's changing the way that we make decisions as an organization. And that's a fabulous thing.
Yeah, so there was, as more use cases came to leverage Domo, that meant those use cases, they need to have data to back them up. And when we started looking through, and I think there was like 68 different data sources that we were coming across. Correct. They're in 68 different areas of the business. And when we started looking at the way that they were reporting and the way that they were doing their current reporting, they were pulling pieces from this place, pieces from that place, and then without absolutely knowing what was the cause and effect, if something from this area changed, how is that going to affect the downstream sense of that data that's going into Domo? And so one of the things that we did as a very strategic process was, you know what, let's hold off. Let's hit the pause button here. Domo is an awesome tool. It can ingest just about anything you want it to ingest. It can connect to anything, but let's do this smart. Let's look at what are the end in mind. What's the end in mind? What are the business outcomes that we really want to be able to obtain? What are the things that are going to drive decisions within your organization? What are the other types of elements that are going to be important across the different areas who are people are the end users of Domo going to be able to use to make fact-based decisions? Also, so we decided that we would go ahead and through a lot of counseling with the UPMC team, with the Domo team and everything, we came together and we said, we really need to do an effective data strategy workshop. And this was an event that that took place towards the middle of last year. And it was no simple task. I credit April for organizing, dozens of people to get together to be interviewed, to be able to look at it from all across the different stakeholders within their organization that's going to be leveraging Domo. all the way from the CMO down over across into the clinical area, and then to the actual people that are actually doing the analytics within Domo, and to their agencies of records that are going to be leveraging the insights that are happening in this. It was a pretty big undertaking, but there was a huge value behind it, because what we were able to do is we were able to establish what those desired business outcomes were, what the desired impact vision was, and then the desired altruistic impact. Those were very, very important. And through the data strategy process that we were able to do, we established how to enable their data to achieve desired outcomes and impact. And so we looked across all their ecosystems, their data infrastructure, people, and process. And you can imagine, you're changing a philosophy and a mentality within an organization of this is how they've been doing this for years. So I think these guys can agree with me. One of the biggest things that we really had to really focus on wasn't necessarily getting the right data in the right place and producing the right outcomes that are the right insights to drive outcomes. It was more, how do we change the people within the organization to start utilizing this and start thinking differently, start using data with purpose to drive the most optimal impact of your business. Would you agree?
Absolutely. I think one of the most interesting things that we've been doing is actually looking at the process, right? So when we start something, when we start a marketing project, right, we have to ask ourselves the question, who's the target? What's the business problem that we're really trying to solve? And then how are we going to address that, right? Like, what are we going to do to define those targets, to segment that market, to determine what the outreach channels are and how we're going to track success, right? And the whole process that we've gone through with SDI hasn't just been about connecting the data wires in the background. It's been about blowing up and rethinking and reformatting that process to leverage the data in the smartest way possible and in the way that's going to most effectively move us down that chain and get us to the point where we're looking at ROI, where we're operating efficiently, where we're making the right decisions, right? So don't be afraid to think about that, right? If you're changing the way that you interact with your data and you're using the Domo platform as the way to do that, use that as an opportunity to reinvestigate what your process is and whether or not that process is working for you and making sense and really driving the actionable insights that we all in this room know that we want to get to.
Yeah, and if I could add to that, there is a real cultural shift that occurs when implementing Domo. I wasn't afraid of getting the data inside of the platform. I wasn't afraid of the QA process, the connections, the reporting. None of that scared me. The cultural change within the organization was what kept me up at night in terms of how are we ever going to get people to understand what is happening? How are they going to understand what the impact is to their jobs and why it's beneficial? So SDI has been key in helping us get people to adopt the tool, get them to understand how to use it. We've done incremental baby steps in the process of doing training now, rolled it out to about 100 people, and we have office hours. We set alerts for them. We get some reports emailed, everything just to get them to log in and get comfortable. So that's where we are now, and it's an evolutionary process we're going through.
That's absolutely correct. And one of the things that was very important as we addressed this throughout the different stakeholders within UPMC is we wanted to make sure they understood, and everybody should understand, that when you're using data, when you're using data to inform business decisions, to be able to achieve specific outcomes or to be able to alleviate pain in different areas, that's never a destination, it's a journey. Everything changes often. Data never stays the same. Data is always going to change. There's always going to be more data. There's always the data that you currently have is going to change its face. So there has to be a way that you can be nimble enough and have a culture that is going to embrace the power of that data and to be able to leverage it. And one of the great things about Domo was the fact that it was nimble enough to be able to take that into effect. The fact that Domo can probably connect to just about everything. If my mom had a website online for her recipes, we could connect to that. I mean, it's just crazy. And so it's been an awesome tool to be able to look at this from a single source of truth. around when it comes to taking a look at all of these different disparate systems that are coming together, from their DMP CRM systems all the way around from the patient data and call center data. And we're looking at it, from more of an operational end now, is how is this marketing data informing operational issues? I mean, the sky's the limit. And the fact that it's going to be a constant journey, and the fact that Domo provides an environment for that to be nimble and for that to evolve along with it, where you're not in a black box to where once you get the data in there, you're kind of stuck until you have to get another cube put on or another plug-in over here. And the fact that they are being so innovative with the type of apps that they're utilizing, the App 360, for example. They just did a breakout session before how that helps them with a lot of the decisioning that's going on within there, and how the stacker really allows to organize the data in a way that allows for great use of that data. So SDI took the approach of saying, we want to make sure that the relevant data is going in there in order to make it as powerful as possible to bring the most power into Domo so that there's confidence and that it could be leveraged in a way that they haven't been able to leverage data before. And also, the big mantra was, from our very first meeting with their CMO, was, folks, we want to be more proactive and less reactive. We get all these great reports right now that tells us what we did. Can we find views? Can we find data? Can we find things that are out there that is going to give us the type of insights that not only tell us what we're doing, but also provide us the ability to react to that in a way that is going to be the most beneficial for the type of outcomes that we really want to achieve? And so some of those impacts that we were talking about is, the outcomes from the whole data strategy process that we took was, we identified desired outcomes. It allowed us to have new analytic capabilities. It is continuing to improve the data literacy in scale according to the areas that need to have the right type of literacy for what they need to use it for. Ensure data security and privacy. The whole HIPAA compliance thing, I'm going to let Jake talk about that in a second, and then activate data into the business, and understand the company and patients. I'm going to let Jake and April expound on this a little bit of how we found how these outcomes have been very important with how we're moving forward with Domo.
Sure, and we'll step through them one by one, kind of give you an anecdotal view of some of the things that we struggled with. I think the first one, the identifying desired outcomes, and this is something that April and I both talk a lot about. We lived in a marketing world where each of the different clinical service lines is managed by a different marketing manager, right? Your Heart and Vascular Institute has one marketing manager responsible, vice versa. Everybody picked their own stats. This is how we look at things for HVI. This is what a success metric is for us. And it was different when you moved over to the cancer workspace. Well, that's great, and that may make sense for HVI and for cancer, but as a marketing organization, how do I compare across campaigns? I can't. Well, the moment you can't compare across campaigns, how am I measuring effectiveness? How am I determining any of these things? How am I making decisions, right? It's not about, and this is one of the things that we struggle about, it's not about being punitive. It's not about identifying winners and losers. It's not about putting anyone's job on the line, but it's about making you more effective. And if we don't have a metric for comparison and we don't know what outcomes we're looking at, how are we going to do that? And so what we really quickly did was try to get everybody on the same page in terms of, these are the 5 outcomes we're looking at in every campaign, right? And we're going to address them systematically, and we're going to do comparisons. And when something isn't working, then we're going to be able to change it. So it's actually about making you more effective, right? So it was, how do we pick what success looks like, right? And how do we identify that? And then how do we push that out and do it in a uniform way across campaigns, right? You want to talk about it?
Yeah, so we've set up less than 10 KPIs that are the go-to KPIs. Any deviation from that isn't relevant to us in terms of the overall roll-up to the organization of, to prove effectiveness. So we're getting buy-in on what the relevant campaigns are overall across all the platforms, across all of the service lines and the campaigns. So that was no small feat to get buy-in to. So we're doing that now, and that's enabled us to use the Advertising 360 app to cross-compare cross-tabulate campaigns, by their platforms. Okay, maybe this platform is working better for this campaign. Maybe Facebook connects more to, people looking for concussion treatment. So we can see the nuances now, where before everyone had different KPIs that didn't align, so there was no ability to see across the whole organization.
The next two in my mind kind of go together, right? New analytics capabilities and improving data literacy. Of course, we had to develop some new analytical capabilities that we did not have inside of the organization to leverage the data that we had, right? And in some cases, we had to actually train people what those analytical capabilities were going to look like.
Well, you could take it a step back. You had to hire a whole new team.
That's true.
Yeah.
Let's start there.
Yeah.
We had to hire a digital marketing team who understood what digital marketing looked like and where those KPIs started, right? Let's not forget that, because some organizations don't have that inside. And so you've got to have the team who understands and is going to work with this stuff before you really even start taking those first steps, right? But once you do, then you've got to make sure that you actually have the analytical skill sets that match the data that you have. There are lots of people in our organization who don't work with patient data. Many of them live in the marketing world. And all of a sudden, we were going to bring patient data in, and they'd never seen it before. Well, how do you teach them what shifts in volume look like, what those key indicators in a patient data set are going to be, right? And how do you do it in a way that's not scary or disruptive or throws out kind of all of the other good things that we've been doing for decades as we go through this transformation? And that feeds directly into improving data literacy. And I'll stand here and be honest, you're never going to get everyone to the same level of data literacy, right? But what you do have to do is the people who are going to be the most data savvy people in your organization is get them all a level that they need to be at so that they can effectively make those decisions. And if that means boiling it down to having them understand those 5 metrics that April talked about that we're going to look at, or 10 or whatever the number is, then do that, right? Sit with them and take the time and make sure you get them where they are, because that's their own journey as they're moving through things, right? It's easy for us, the data savvy people, the data wonks as I call us, to get really into what we're doing and forget that there are a whole bunch of people for whom this is scary, and there's got to be some nurturing there and moving them along, right?
At a tactical level, a data dictionary works wonders. It's a point of reference for everyone. It outlines what everything means, so there's no confusion, and it has the conversation open, available, and everyone's starting from the same level playing field of understanding.
And to that end, I think it's been useful also to have both data user group meetings where the heavy users can get together and discuss things, nuances, ask questions, talk about some of the new analytics we may want to roll into things, as well as user meetings, right? So those clinical marketing managers, they've got a chance to ask that question in a way that feels more natural to them. And I would add that we take that data dictionary or that glossary of terms and we append it to every Domo report we send out, right? And each one is kind of customized for whatever that campaign is. We showed it in our last session for the LDLT one. I recommend each one of you does that. It will head off a lot of questions. You won't spend your time answering the same what does this mean question 15 times a day. But more importantly, it empowers the people who are receiving that report to feel like they understand what they're looking at.
Where do we go now?
Yeah, effectively governing data. Ooh. So that's tough, right? It takes a lot of people to effectively govern the data in a healthcare organization. And it's interesting because while we have our own concerns about what data governance is for our marketing group, certainly our patient safety and security groups also have their own ideas about what data governance should look like. And so as we start to marry some of those patient data pieces into what we're doing, we not only have to make sure that we're effectively governing the data in the way that we want to, but that we're communicating with those outside organizations, that we're adopting their best practices. And this is going to be true for any of you, because the moment you start taking another team's data and plugging it in, if you aren't respecting the way they like to work with that data, you're going to find it gets tougher to get it the next time, right? So how do we do, and I love this, right? Josh used the term last year at Domopalooza, democratizing the data. And I love that, right? How do we make it so everybody can get their data on their hands? The power is not in hoarding data and being the only one who knows an answer to a question. The power is taking that data and making it work for your organization. So how do you do that? And how do you do that in a way that kind of puts you hand in hand with your partners and other pieces of the organization? And how do you make sure that that data is, clean, right? All of those types of things that you want it to be, hitting the right cadence, being utilized effectively, updating the right way, all that kind of stuff.
So how we did it with the help of SDI was we formed a data governance council that includes key members in departments internally in our organization and then key members of our agency partners. We have a lot of agency of records that handle our creative, that handle our digital platform buying, our analytics, so on and so forth. So we get together monthly to discuss discuss issues and lay out a roadmap, and if there's anything that needs to be voted on, it can be voted on. And our agency partners are influencers, but they're not active voters on the council, so we keep that internal.
And I think that's an important thing to note, right? And for many of us, your team is going to extend outside of your immediate organization's walls. Don't be afraid to loop those people in. You need them, right? They may be your agency, but they're also your partner in this, and get them to work with you. And all that kind of also feeds into, right, data security and privacy. As you think about governance, those two things kind of flow together, right? And so for us, it's not just about securing the patient data, which is of course tremendously important, right, being HIPAA compliant, but it's also about the analytics that you feed. How do you make sure that the right person in your organization is seeing what they should see, and that maybe someone who shouldn't see that data isn't seeing it immediately, those types of things, all those controls and the things that you can easily implement in Domo, but you have to have a plan. You have to sit down, you have to think about those things in advance. You have to say, who's gonna see what, when are they gonna see it, and why? How do we make sure that stays secure? How do we do all of the things that, our chief security officer wants us to do with that patient data? Otherwise, I'm gonna end up in jail for HIPAA violations, and I don't wanna do that. That's not how I spend my time.
Yeah, and then the final thing, activating the data into the business. We spent a lot of hours gathering requirements from various departments to understand what is important to them, what they act on. So that took a lot of background work.
Right, and I think that comes back to you have to decide what your goals are. If you don't have a very clear understanding of the business problem that you're trying to solve, then you can't effectively set metrics for success, and then you can't optimize and you can't track. So, I'm a strategic planner by trade, right? You got to back everything up to that. What are we trying to solve? How are we going to do it? And until you do that, you're not going to activate that data. You need to know what the questions you're asking are, and not just your questions. What do your executives need, right? How do you solve those business problems, and how do you get into those types of things? And if you do all that, I think you're going to find that you understand your company, you understand your customers, or in our case, patients. And once you do that, then you're actually really able to leverage everything that you've done in a way that is going to drive your business forward and make you more effective. And it's going to be the kind of thing that you look back and wonder, how did we live before this, right? Because I feel like that's where we are now. That is that question of what did we do before we had all of this actionable information and we had a really great way to kind of get it out and into the market.
Very good. So one of the great things about this whole engagement with UPMC and helping them go through this journey has been able to see the progress of change that's been going on, not just only through how Domo has been able to activate data for them to make better business decisions, but how that's changed the mentality within their organization to strive for bigger and better things. And it's been very encouraging to the fact that, one of the key stakeholders that we work with at UPMC, his name is Rob Miller, and he gave us a quote saying that Domo, through the skilled collaborative partnership of SDI, is in the process of changing how our department operates. We are moving from a spray and pray marketing approach to an evidence-based decisioning ROI model. He's been there for 8 years, and he honestly is amazed. He says, my team, as well as the CMO, sees the collaboration with SDI as the new model moving forward, and the progress we've made is remarkable. Now, I'm not doing that just to toot the SDI horn here, because anybody can do this with Domo. Well, what I really want to press is the process that SDI took to be able to get to these outcomes. Because Domo, as an awesome tool it is, as an awesome piece of a platform that it is, you really have to be very strategic with the way you really want to use it to bring the most value out of it. And the way that you can be the most strategic is by understanding the data assets that you have, leveraging those data assets to its fullest capability, go through that process, understand what can be leveraged to build what type of outcomes or be able to facilitate those outcomes in a very strategic way. And I will tell you, if you have an opportunity while you're still here at Domopalooza, come to the Search Discovery booth. We have the opportunity, if you want to sign up for a 30-minute data strategy exercise, It is an awesome thing. We use Domo to do it. It's a great exercise that kind of gives you a current state versus some benchmarks in different areas. And it'll help you understand maybe some of the initial paths that you might want to take going forward. Love to have that conversation with you. And so you just go to our booth and sign up for it, and we would love to have those further conversations with you. And with that, we want to thank you, and we're going to open it up for questions. We got a couple. Has anybody got the mic? Tell you what.
I can go do it. Oh.
Who had a question? Start back there.
I was wondering if you could share one or two things that you would do differently if you had to do it again.
Well, that's an interesting question. Okay, I got an idea. My favorite meeting every week is actually with some SDI folks. We have what I would call an intellectual navel-gazing meeting every Friday, which is where we sit around and talk about our process and what's working and what's not working. This is less on the digital marketing side and more on the planning side, right? So when we get a market research question, like how do we break that down? How do we address that? I wish we'd moved that way further in the process, to be honest with you, because some of the things that have come out of that process discussion are now making me rethink the way that we do some things on the back end and how we engage people. So while it seemed like, hey, let's get all the nuts and bolts together right first and make sure that everything is clean, part of me wishes we'd started having those process conversations earlier on. So that is something I would do differently. You don't ever know that except looking back. And it's all good stuff, right? These are great problems to have, but certainly something I think I'd redo differently.
I would probably engage the government council, data governance council earlier on in the process to make sure that all of the agencies had a very clear alignment and understanding of what it was we were doing. I mean, we communicated, but still, there's room for error in interpretation because we weren't all around the table at the given time at the same time.
Hello. So I have a question about, I guess, the process and the 360 app, as Domo is calling it. So it sounds like the app is maybe like a framework of cards, and then it sounds like you got a couple different teams here, as the SDI team being, I guess, an implementation team, and then April, your team, which I guess are more of like the people who are doing the actual work. I just wanted to understand a little bit about the roles and responsibilities of each of those teams and how much involvement Domo had to get you to where you are.
Sure, I would go a third, and third, right? I couldn't really attribute, at an unequal measurement, but SDI has worked closely with my team to help us understand the app 360 and its capabilities and functionality. So that was key in getting it all to come together because, it was in beta while we were working with it, and, it was robust in terms of its power and functionality. And we could only really have a depth of understanding with a partner like SDI.
So I think, right, because I'm a little bit outside this, right? So we kind of have the market research piece, which comes up front. And by the time April's team's engaged, we're to the point where we're developing tactics and we're tracking things, right? So for us, we're sort of just outside that circle. I would say it's more like April's team are the subject matter experts. No one knows our content or what goes on better than they do. SDI knows how to connect that content and format it and make it look great in Domo, and Domo understands the platform. And in all honesty, it is a third, each of them acting together as one group, right? And it's not as if they're disparate groups, right? We're on the phone with SDI and Domo just as if they were internal members of our own organization. There is zero curtain of privacy between us in that regard, right? And to your question about the 360 app, yeah, it's a preset set of cards and a dashboard, and it kind of cleans it up and guides your thinking, but it's also infinitely customizable so that you can take your own data and display it in a way that makes sense, but it gives you something to think about. It gives you a view. It lets you, I like to say it's really a great way of having both an executive view and a power user's view. You can kind of create a different 360 experience for each of those, and then kind of people can come in and just engage as they want, as opposed to more campaign-specific dashboards that we've had in the past, if that makes sense. Comprehensive.
Can you hear me now? Okay, great. I think it was a commercial, wasn't it? Can you hear me So thinking about how you're using Domo, obviously marketing, I'm guessing finance has got their hands in a few things, operations. So I'm specifically interested in are your clinicians involved? And are there interests being piqued? I'm thinking of outcomes, I'm thinking of all that sort of stuff that, as a sort of a fellow healthcare provider would understand. Kind of where are you in engaging your clinicians?
Absolutely. They're not there yet today. They're using other systems. And this has been the interesting thing, right, is as we sort of are out there with Domo as our tool, we're getting great questions from other people who are like, wow, they see the power immediately of the platform. So there's been no desire to push things down from the top organizationally as to what tools you'll use. So organically, they're starting to see an attraction there. So today, no, they're not using it, but it's not because they've decided it isn't the right tool. It's more they just haven't had a chance to get into it. And we actually have a high expectation that we're going to start to see a lot of bleed over into those areas because it is a powerful platform, and the data will already be there by the time they come to it. So why wouldn't you use it?
Absolutely, and we do field a lot of questions from the clinical side of the business, and when we were talking about the whole data literacy process earlier, there's specific things that, what has been a legacy process for them to understand what they're seeing and what they're doing and how they react to it. The way that Domo is being organized and the type of insights that it's getting, that's a big cultural change for that part of the business. And so as a team, we are constantly working with the clinical sides, and we're building that up. And like I said earlier, it's a journey. And so on the scale of where they're at the maturity, they're at the beginning stages, but there is a process that we're taking to build that up.
2 years.
Yeah.
So I mean, not relatively short, given I think what we've accomplished and with the patient data and those complexities. So I think that's a credit to both Domo and SDI that they've done some wonderful work to get us as far as we have as quickly. Well, that's a tough question. Right now, it's kind of service line specific, but we are eventually hoping to upload and mirror our whole Cerner and Epic record systems into there. We're thinking about adding the Metapack data in, I mean, pretty much everything, so that you'll have a full view of longitudinally what a patient does when they come into the system, and that'll only include, obviously, those fields that we have in Epic and Cerner, right? We're not going to do physician notes and some of those things, I should say yet. But that will give us enough of a view to start making those kind of insights actionable for us, right?
We have time for a couple more questions.
Hi. You cited the data dictionary. I was wondering if the data dictionary is built within Domo or it's outside. More importantly, how did you spread out the dictionary across the company? Thanks.
Yeah, sure. The data dictionary actually lives inside of Domo. It's a card there. We actually associate a different data dictionary with every piece of analysis because there may be terms that are specific only to one service line or some of those things. So it gives us some flexibility. But we can use that same card as a basis when we recreate it for the next one. 80% of it stays the same. We tweak it slightly. And then if we never have had to do this, but we could keep a comprehensive dictionary there. It lives in Domo. It becomes part of that report. And so when anyone accesses it, it's always there at the end for them to refer to, and we've just kind of made that a standard operating procedure, and everyone knows that it's there. But I should add, we have to be very careful when we make those definitions, right? That actually takes a group of us sitting in the room and making sure that we have alignment and we agree before we push that out. Because there have even been times within the data team where that means something a little bit different to me than it does to you, and how do we address that?
And really, that's an important function of the data governance process and board that's been established to help build that. And on top of just the data dictionary, there's also, as far as rules and, standard, definitions that we use, so that the same definition for a conversion that definition remains the same across anybody who's saying a conversion, or is it not a conversion but a call to action? There's differences between those things. And so those are all documented and within Domo.
Right. And I'll give you a piece of nuance here. A conversion for someone who are trying to get in for a cardiology visit is very different than a conversion for someone who I'm trying to get signed up as an LDLT evaluation, right? Those are different things. And so for us, we would say in that report, well, we're looking at LDLT, this is the conversion here, right? That definition can vary from service to service, but it shouldn't vary from person to person.
Absolutely. One more question? Oh, right in front of you.
That question.
Here's one right here. Last one.
Hi, have you integrated any patient experience data into your dashboards?
Sorry, did you say patient experience?
Patient experience data.
Absolutely.
And what are you seeing in terms of correlation between patient experience data and marketing effectiveness?
So that I should say we are not directly correlating today an individual's patient experience with their likelihood to return. We are only looking at those things in aggregate. So I actually tie it to the clinical service, right? I know what the patient experience, I know what the patient satisfaction things are from HVI, our Heart and Vascular Institute. Now I'm looking at the marketing outcomes and those types of things from HVI. So it's more of an in concert than it is direct, because for us, there are still it's too difficult to link that data from a privacy standpoint today. That's not to say that we wouldn't love to get there, and that's definitely on my roadmap for the future, but we're just not there in terms of being able to follow that individual through in a HIPAA-compliant way.
Okay, well, maybe a supplementary question then. So what about reputation? Are you looking at any health grades data or any of the other provider reputation data?
No, that's a fabulous idea, and it's one I'm going to go home and start exploring, so thank you for that.
We were hoping you could give us the answer.
That's brilliant.
Yeah.
Sure, right. Yeah, absolutely. That's a great idea.
Well, everybody, I really thank you for attending this session. And then again, if you do have other questions, feel free to visit us at the booth. We're the first booth as you walk into the main hall there. And so if you want to sign up for that 30-minute data strategy little workshop, feel free to do that. I know some spaces are still available. And on behalf of Search Discovery, who is a very proud partner of Domo, we thank you, and we wish you all luck with your future use of Domo. Have a great day.
Thank you.
Thank you, everyone.